Hi friends, good evening and welcome back to my channel Mukambika Nursing. Friends, in the previous video we discussed expected questions and its answers, video number 6, and here we can see the next set of questions which will helpful for your upcoming exam. Here we can see the questions. First question in this series is, which is the basic nursing action during the management of pre-eclampsia is? Under options, option A, assess fetal heart rate. Option B, advise MGSO4 therapy. Option C, advise for rest. And option D, all of this. Question is, which is the basic nursing action? Okay, basic nursing action that we have to focus. Basic nursing action for a patient with pre-eclampsia is. Answer is option C, advice for rest. First option, fetal, assess fetal heart rate, advise MGSO4 therapy. That are the management for pre-eclampsia. Here our question is basic nursing action. Okay, so option C, advice for rest is the correct answer. Next question. The color used for tagging dead body is option A, yellow, option B, red, option C, black, and option D, green. And the correct answer for this question is option C, black is the correct answer. And the remaining option in this red indicate emergency, that is high risk patient. They are coming under red tagging, okay, and they need treatment within 6 hours. And yellow means they are also need care, but they need not that much emergency and they need care within 6 to 24 hours. And green means they are ambulatory patient. Here option C is correct. The next question. In the neonatal period, pseudoudin syrup 2 mg per kilogram orally 4 times a day given for a period of, and options, option A 6 days, option B 3 weeks, option C 6 weeks, and option D 8 weeks. Correct answer is option C, 6 week. In the neonatal period, pseudoudin syrup. Pseudoudin syrup is an antiretroviral medication which is given to treat HIV infections in neonatal period. So it should be given 2 mg per kilogram orally 4 times a day for a period of 6 weeks. Option C is the correct answer. And the next question, which precaution a nurse must take during phototherapy? And our options, option A, leave the infant clothes on. Option B, check the infant's temperature once a day. Option C, reposition the infant infrequently. Option D, cover the infant eyes. And the correct answer is option D, cover the infant eyes during phototherapy. And the next question, color of cyclopropane cylinder is, and the options, option A grey color, option B blue color, option C orange color, and option D brown color. That is the color question is color coding of cyclopropane cylinder. That is the question, and correct answer is option C, orange color cyclopropane cylinder, which is mainly used in the anesthesia setup. Okay, and the color coding is orange color. And the remaining option, grey color is the color coding of carbon dioxide cylinder, and blue color which is used the color coding of nitrous oxide, and brown color in helium cylinder. Here cyclopropane cylinder is orange color. The next question, assessment of vaginal discharge contain decidual cell, epithelial cells, lanugo, which indicate which variety of lochia is. And options, option A rubra, option B serosa, option C alba, and option D all of this. Our question is vaginal discharge, that is vaginal discharge is known as after delivery, vaginal discharge is known as lochia. So the lochia contains decidual cells, epithelial cells, and lanugo. So that indicate option C alba is the correct answer. Lochia is the vaginal discharge after delivery, and if it is coming till 14 days, it is normal. If it is coming more than 21 days, it is considered as abnormal. And the normal blood loss during this period is 400 to 450 ml. That is considered as normal. Lochia consists of Leucia rubra, Leucia serosa and Leucia alba. Leucia rubra means it is from first day to fourth day, 1 to 4 days, and is red in color, and it consists of RBC blood cells and mainly cotyledons. Okay, and next is Leucia serosa. Serosa, it's from 5th day to 9 days, and it is yellow in color, and it mainly consists of WBCs. And the next is Leucia alba. Leucia alba from 10th day to 14 days, mainly it is clear or white color, and it consists of epithelial cells. Okay, here our question answer is Leucia alba, option C. The next question, the ratio of cardiac compression and artificial breathing is, options A, options are option A 15 is to 2, option B 30 is to 2, option C 10 is to 1, and option D 60 is to 2. Question is the ratio of cardiac compression and artificial breathing is. Correct answer is option B 30 is to 2. This is one of the important questions from cardiopulmonary resuscitation. Okay, that is CPR. And for in CPR, for one rescue, we have to give 30 compression and 2 breathing. Okay, that is the question. Cardiac compression and artificial breathing, 30 compression and 2 breathing in case of one rescue. And the next question, the vaccine administered as an intranasal spray is. Options are option A rubella, option B poliomyelitis, option C measles, and option D influenza. The vaccines which is given intranasal spray is option D influenza vaccines. Influenza vaccine can give as a nasal spray. And the next question, which group of drug is also known as thymoleptics? And our options, option A anti-manic, option B antidepressants, option C analgesics, and option D anti-Parkinson's. The correct answer is option B antidepressants is also known as thymoleptics. The next question, in following which is not a chemical disinfectants? And our option A phenol, option B cresol, option C formalin, option D sodium. And the correct answer is option D sodium. Sodium is not a chemical disinfecting agent among this. Okay, remaining option phenol, cresol, formalin is all coming under chemical disinfectant, but sodium is not a chemical disinfectant agent.